Hi, I'm Momodou Jammeh, a vascular surgeon with Froedtert and Medical College of Wisconsin Health Network. I went to medical school at Duke University School of Medicine, and then did my residency at Washington University in St. Louis and Froedtert Hospital. Before that, I went to college at the University of Wisconsin here in Madison. I primarily treat adult patients over the age of 18. Generally, those are the individuals that tend to have vascular disease, but some of our practice can involve pediatric patients, so patients under the age of 18 who may need dialysis access if they have renal failure or who have some unique congenital diseases involving their vasculature. Generally, I do all of vascular surgery. But my primary interest is in treating patients with aortic pathology. So these are patients with either aortic aneurysms or aortic dissections that with or without aneurysms. My practice philosophy is a holistic approach that begins with understanding where the patient is coming from. Vascular disease can be quite debilitating, and patients come with different goals. For instance, patients with leg wounds and leg pain, some of them might be willing to undergo multiple procedures to get them through that process, as well as get them back to a functional limb, but with their limb in place. And some patients just want to get to a point where they're quickly out of pain and quickly back to a functional status, whatever that may be. And so understanding where the patient is in that process helps me guide them in terms of how intense our interventions are going to be and how quickly we can get them back to where they can be and where they want to be. One of the exciting things about vascular surgery is the advances in technology that have allowed us to really treat very extensive pathology through minimally invasive approaches. Generally, for instance, in my area of interest, when we talk about thoracoabdominal aneurysms, these are diseases that typically require large incisions involving the chest and the abdomen, which patients enduring hours and hours of surgery and and with a lot of pain and other morbid consequences afterward. Technology has evolved such that these same operations can be done using stents with wires and catheters, using small incisions in the arms and the groins. And Froedtert is really one of the few places in the state where you can reliably get that done and expect to have an excellent outcome.